Thank you for staying with us. This is still Signature Morning on Signature TV. We're still talking on Nigeria health sector. This time around, we're also going to be talking on health tourism. With me in the studio this morning is Professor Ben Edel, who is a pediatrician. Good morning. Thank you for joining us.
Thank you.
All
It's a
right.
pleasure to be here.
Yes, pleasure to have you here. All right, now, first of all, before we go into this conversation, we're still mourning the passing of our former president, Buhari. Now, how do you feel upon, hearing of his death on Sunday? What was your initial reaction? How did you take the news?
Well, I wouldn't say well, it was quite an unfortunate incident. But you know that all of us in this world will surely die one day or the other. So, but I think he has really done, well, I say what he actually came to do in this world, and his time was over. So, but at least we will remember him for all the good things he had done, and also the ones that he didn't do very well, which you know that at least when you palpate Nigerians, you have mixed feelings. Yeah, but quite a loss for the country though.
Yeah. Speaking of mixed feelings, I would like to know what are your thoughts on, his performance and when he was in office, both, as a military president and a civilian president.
Well, as a military president, then, there was such a discipline because I think that was part of the reason why a lot of people even clamored for him to come back to see whether Nigeria will improve in terms of the corruption and other indiscipline, rampant in the country. But it seems unfortunately his second coming wasn't like the first time during the military era. So, but just like we all know that this is a his past regime as Nigeria's president. But 8 years had a lot. And coming for at least talking about the health sector, you know that the health sector didn't really do very well within that 8 years. At least because if he did, I don't think he would have been flying abroad for his treatment. Yeah, so if you look at it, you will see the things he did well, but you'll see there a lot of negative things and things he didn't do quite well, which we're all witnessing today.
All right, now let's look at Nigerian health sector. What would you say is the current state of our health system in Nigeria as it stands today?
No, Nigeria's health system today. Well, I wouldn't say, if you compare it to what we have in other countries, I won't give it a pass mark. That's the truth. But I know that there are efforts to improve the health sector, but the challenges are enormous. And that's why we still have politicians all traveling abroad for Medicare. We have the manpower. In fact, you can see that other countries are pushing on our manpower. But the infrastructure and the enabling environment, they're not just there. And that is why we are suffering what we are suffering in the health system. Yeah, because we have good doctors, we have good nurses, pharmacists, and all in Nigeria. And other countries appreciate that. That's why they keep pushing.
So, what would you say are the challenges? Because you mentioned we have a lot of challenges. So, what are those challenges?
First of all, let's start with the health sector finance. Financing the health sector in Nigeria the finance is so poor. I remember in 2001, there was the AU. They had a meeting in Abuja. There was the African Union. And there they agreed that each country should budget at least 15% for the health sector. Nigeria has not even done up to 5-6%. And you can imagine our whole population, and then you look at the budgets every year, how much is allocated to the health sector. Find out that it's not enough to take care of the challenges of the health sector. Talking from the personnel cost, infrastructure development, And that's why when you go to a lot of government hospitals today, what you will see is dilapidated structures. The equipments are outdated. We don't improve like other countries, that keep updating their systems. Yeah. What we have there is just personnel. And then even this personnel, because they're not well remunerated, their work attitude, you can't really say is the best. So that is one. And then you look at other aspects now, talking about the personnel now, which still stems on this poor funding now. Because I find out we have a lot of people leaving the country. Just in the past, you can imagine, okay, I remember sometime last year, the NMA president said that Nigeria just had about 55,000 registered doctors in the country. The population of 230 million, you can imagine where would that go? And then you look at all the doctors and nurses going to the United Kingdom. In the past few years alone, you know that over 10 to 15,000 doctors and the same amount for nurses have emigrated to the United Kingdom. You are not counting the ones that have gone to United States and Canada and all the other countries. So when you get to the government hospitals now, or even the hospitals now, you find that there is a drop of doctors and nurses. And even the few that are left in the country are not equitably distributed. Because according to WHO, the standard that you need is about one doctor for every 600 patients. What do we have in Nigeria? One doctor to about 4,000 to 5,000 patients. And when you look at it, you find out that most of these doctors and nurses are even concentrated in the urban areas, where you have the teaching hospitals and then some of the big private hospitals. So if you go to the rural areas, some of them have not seen a doctor for years. They've been attended to by quacks. Those that run, that open what they call patent medicine centers, and then some poorly trained nurses. And even at that, I will say we are even fortunate that even the southern part of Nigeria has much more doctors than what you see in the north. And because of the insecurity challenges too, a lot of health personnel are not willing to work in certain places in Nigeria. So you can imagine the fate of the people who are living in such areas. And then with the insecurity, what happens when they get injured and all that? Who's going to treat them? You find out that these are some of the things we face. And then talking about insecurity too, because you know the level of insecurity in Nigeria today. That is one of the push factors that make doctors not to, stay in this country. And even the doctors and nurses, some of that. Let me talk about the doctors we have in the diaspora, UK, US. There are many of them that when you speak with, they will tell you that they want to come back to the country. But because of the insecurity challenges, they're afraid. So the government has quite a lot to do to improve our health sector. Yeah, not just even the work environment is nothing to write home about. Because some of these doctors, some of these hospitals, you get the things to work with are not there. So even when the doctors are willing, you find out. Then on the part of the patients themselves, you find out that most of these patients pay out of the pockets. We don't have enough health insurance coverage in this country. More than 70 to 80% of Nigerians pay for health from their pockets. And you know the implication of that. A lot of people can't afford the health care. And that's why we have a lot of mortalities. People are dying in their homes, in their churches, some just prefer to patronize the alternative healthcare this traditional
Yeah.
yes, healthcare. So that's why you have a boom in that sector too. And what's the implication of that? You have unregulated, intake of traditional medicine and concussions, and they end up with kidney damage, liver damage, all still coming back to the health sector for treatment, which they can't afford. So we have quite a lot of challenges.
Yes, we do. But I asked this question before, and I'll ask you the same question. Why is it that some medical personnel that work in public hospitals, right? When you talk about these issues with them, they tell you that it's affordable. It's more affordable in public hospitals. You have qualified personnel in public hospitals as opposed to the private hospitals. But then when you ask the patients, the people who are actually going there, they tell you it's so expensive, and when you get there, it's either the doctor is not that is supposed to be on duty is not there, or the nurse is not there. And it's quite difficult to reconcile these two narratives, because on one hand they're saying it's affordable, there are professionals here, and on the other hand they are saying it's not affordable, there is no one there. So it's, you know.
Yeah, I still thank you. It still boils down to the same funding issues, because the public sector, there's no argument about that, have the best of specialists and professionals. Yeah, because you find out that even the same doctors you're seeing in the public sector, even at least many of them are still the same doctors you see in the private sector. So the patient's telling you that it's not affordable. It depends on the comparison, what you're comparing, the level of care you're getting. Because you have some of these private sectors where they don't offer much. So, but when you look at, maybe for instance, let's say for instance, someone with, let's say, kidney failure, for instance, now, you can't compare the cost of managing a kidney failure patient in a public hospital to managing the same patient in a private hospital. Definitely, the private hospital, they are set up for not just to treat, but to make profit. Yeah, even though, yes, you can agree, I will agree with you that a lot of the private hospitals will give you better attention, and you feel a better sense of being well taken care of in the private
Private.
hospitals compared to the public hospitals. But this still boils down to the same thing, because if the doctors and the nurses or the healthcare professionals in those private public hospitals are well paid, I think they will devote more attention to their work. There won't be distractions. And but a hungry man is an angry man. You remember that saying. So somebody who is working in a public hospital is thinking of, how do I even transport myself to the hospital? How do I feed my family? How do I pay my children's school fees? At the same time, you expect him to give the best. So it's difficult in the present day Nigeria.
Yeah.
Yeah.
All right. Now let's look at health tourism. Now we're seeing that some Nigerians who can afford it are, leaving the country. They are going abroad for healthcare. So would you say that it is the deplorable state of our healthcare that is making them to leave?
Yes and no. Yes, in the sense that some of them just simply, want to use opportunity, like I'm talking about the politicians, for instance. They can, even things that are simple, that can be taken care of in Nigeria, they still fly abroad, just to create that class, the disparity division between, them and the rest of Nigerians. But then you find out that those of them going abroad there will tell you that when you get there, a lot of the people that take care of them are still Nigerian doctors and nurses. So what does that tell you? That the reason why probably they go there is because of the environment, the infrastructure, which can be provided in Nigeria. Because if this same government and politicians can put these things in place in Nigeria, I don't think there's need to start going abroad for treatment. Yeah, because we have the personnel, like just like I said, we have the specialists, we have the manpower. The only thing we lack is the infrastructure, which you cannot compare to what you have abroad. So, but when it comes to practice, it's quite unfortunate that the politicians don't trust what we get
Yes,
in
because
Nigeria.
talking about the politicians, because I mean, let's bring it home, right? Our former president, who is late now, was in a hospital in London, and he passed on in that hospital. And then we also see, you know, some other politicians who say, "Oh, I met him in the same hospital, we're in the same hospital together." And you know, we also have instances of our presidents or other politicians traveling abroad, and even what's his name,
Special
first
assistant.
former special
Yeah.
assistant, exactly, said if he
Yeah.
were in the Nigerian hospital, he would have, you know, died a long time ago. So I mean, that's an indictment already to the Ministry of Health, the minister the Minister of Health, and the entire government generally. So
Yes,
what would you?
I agree with you. It's quite an unfortunate statement because he actually just indicted himself and his bosses because they spent 8 good years. 8 good years. So within that 8 years, wouldn't he have been able to put up at least hospitals that are in the same category or the same class as the ones in London where he visits? Because like I told you, we have the manpower. So what you need is just put up the infrastructure and you get the same level of care in Nigeria here. And you know, like even like if you visit some of the hospitals too, even power supply is a big challenge. And talking about that now, you find out that okay, these 8 years they were in power, they couldn't fix it. Because that's one of the things that are affecting a lot of even private sector. If they tell you the bills that they accumulate just on power alone. So the 8 years and that our former president spent, you know, I don't think he actually had any treatment in Nigeria. And our current president is doing the same. What does that tell you? They don't care about the health sector in Nigeria. Yeah, because if they do, you'll be hearing of, you know, specialist hospitals, government-owned, that are in the same class being built or equipped in Nigeria here. So that at least those who can afford, because I know healthcare is expensive. That's why we need insurance.
Insurance, yeah.
At least for those who can't pay from their pockets. Yeah. And if you find out that if we have big hospitals well equipped in Nigeria, the manpower is there. Some of these people who travel to India, to UK and US for treatment will not do so. They are sure that they can get the same level of care in Nigeria.
Okay, and now talking of you know, doctors and nurses, Nigerian healthcare professionals leaving the country for better working environment. What can be done to make them stay and work in Nigeria? Because it's obviously affecting we as a people, it's affecting the patients, it's affecting the healthcare system, it's affecting a lot of things. So how can that problem be solved?
You see, the truth is that the solution is simple. What is not there is the political will. Because first of all, you have to look at the pull and the push factors that are, you know, causing this. Where are they going? They want better remuneration. People are looking at how do I survive. They look at their children, they look at school fees, they look at feeding, they look at even, you know, what have they? They want to go where they are better paid. You can imagine that a consultant in Nigeria does not earn up to 5% of what his colleague in UK earns. So if you have such an opportunity, you want to go where you earn better. That is one. Then you also look at another push factor, which is insecurity. I know a doctor who left this country because he was kidnapped. After his release, he decided no longer staying in Nigeria. He took his family and relocated. So there are a lot of things. There are even those who are willing to stay back and work. How are you encouraging them? There's no encouragement from the government. The things to work with are not there. And then what's the government doing? Even the training. And you find out that when these people leave, there's nobody to train even the younger ones that are coming up. So in the long run, it's going to even affect the quality of doctors and nurses we're going to produce. Because now what the government is doing is trying to increase the quota for the medical schools and nursing schools in the university. Does that solve the problem? No. Because you are increasing the number of students you want to train. Have you increased the facilities for the training? Have you empowered or at least made the trainers happy to offer, better training to the increased number you are pushing to them? The answer is no. So you look at the other side too. Those abroad who are pulling our doctors and nurses and other health professionals, they know the worth that Nigerian doctors and nurses are well trained. That the problem they have is that they're not satisfied with where they're practicing. So they use that opportunity, offer them better pay, and what's the result? They are rushing. And if you look around now, I'm sure you will have noticed also that there are nursing schools springing up everywhere, every corner of the country. Why? Because the demand for nurses abroad is on the increase. People are not going to nursing school to get work in Nigeria. They're going there to get a certificate and then to japa, like they will say, to other countries where they'll be better paid. And then they'll be able better take care of their families.
Exactly. And now the issue with this health tourism is that at the end of the day, Nigeria is not benefiting from this like other countries. I mean, of course, other countries, you have people who travel to other countries for medical care, but it's a two-way thing. They come to their country and they go, so it helps with their economy. In our own case, Nigeria, we are the ones spending the money from our country to go over to another country for healthcare, and it's not the same. People coming into ours for healthcare. So how would you say that this is affecting our economy?
Of course, it's going to increase the demand for foreign exchange. And that is definitely going to affect our economy. We're not even looking at the other, small effects too. Because by the time even these doctors leave, people who used to afford at least the basic treatment that they get in hospitals can't afford it any longer. So it has a ripple effect. And you don't expect people to come into your country for healthcare when you can't even meet up with the level of care they have in their countries. I remember reading a post sometime, recently. Someone was there was comparison about the top 10 hospitals in Africa. Of course, there's no single Nigerian hospital among the top 10. So you can imagine. So, but you find out that we have even doctors and nurses who are willing to come and render the help in Nigeria. So what our government should do is to develop the healthcare, do the needful, pay the health professionals working in Nigeria well, and they will run away. The working environment, make it conducive, provide the tools for work. You don't let people scratching their heads and trying to improvise what they will work with. Then the issue of drugs too is another kettle of fish. Do you know in the past how many years, how many what do you call it, drug industries that have left the country? And that has made drugs unaffordable in this country. And this still boils down to the effect on the economy. So when you need drugs and then the drugs have to be imported, you can imagine how much it's going to cost. Drugs you have been using, maybe somebody who has hypertension or diabetes, and you know you need to be on these drugs for life. A drug probably you were getting for 2,000 and it's taking care of you for a month. Now you have to pay something like 15 to 20,000 for the same drug. Meanwhile, your salary has not improved. Other things you have to take care of. So you see, what's going to be the effect on the masses?
Yes.
More debts.
All right, but just, do you think that speaking of these politicians and public officials that are traveling abroad for treatment, do you think that there should be some sort of restriction or some sort of ban to stop them from going abroad? Maybe it will help them realize that they need to put more effort into our system.
Who is going to ban them? They are the ones who travel more. So you can imagine telling somebody not to get what he wants when he's in charge. So I don't think that is something they will want to do.
Because they're the ones that make the rules at the end of the day.
So what you rather do is to put up structures that can, make them to, at least attract them to stay in Nigeria. Yeah. Because you can remember during the COVID era, when there was a lot of restriction to travel, some of them were forced to seek healthcare in Nigeria. And luckily for many of them too, they survived. So if that can serve as that didn't serve as at least as a reason for them to develop our healthcare here, I don't know what else can push them to do that, because they understand the implication. But like I said, the political will is not there.
So basically what you're saying is that we are at their mercy. It's just
exactly
we can only but talk at the end of the day.
Exactly. We keep talking. Maybe one day somebody who has a good heart, who considers the things of the masses, will enter there, and then things will change. So we're still living on hope. Hope. And I believe that one day things will get better.
But
some of us are still here.
Yeah, we are all hoping that things will get better. But would you say that there are any risks in seeking treatment abroad?
Of course. When you have an emergency condition, you may not be able to get there before you die. And then sometimes some of these things that are conditions that are seeking treatment abroad, you find out that even abroad there, you don't have the treatment or the solution to their problems. So simply they just go there and die. And the cost of bringing back a dead body to Nigeria is even more than the cost of the treatment, undertaking the treatment there. So, and some of the truth about it is that some of even the hospitals that they visit abroad, like I know some hospitals in India, some people, are not even up to the standard of some of the big hospitals or from big private hospitals in Nigeria. Yet, they prefer to go there. And then some will finish there spending the money, they don't get treatment. And you still see them in Nigeria still suffering the same thing. And at the end of the day, they resort to the same Nigerian hospital and Nigerian doctors that they rejected in the first instance. So the best for us is to develop our own health sector, and everyone will be happy for it.
Yes, thank you so much, Professor Edelu. It's a pleasure speaking with you. We hope that our healthcare system will improve one day and get better. Much. Thank you.
It's my pleasure.
Save Nature TV, news in your pocket.